Hello, everyone, and welcome. I'm glad to have with me today Dr. Dana Fender with Fender-Goggans, orthodontist. And as I was telling your partner last week, when I first saw that good-looking vehicle come through the Dublin Christmas parade, I said, I have got to get that orthodontist. I had no idea who you were at the time.
Yeah.
But one thing about your vehicles, they are seen around town.
Yep. We have it's been a big part of who we are. We love our taxi service. It goes back to I did my orthodontic training at Vanderbilt, and at the time, one of our professors was in private practice. And fortunately, we had our academic guys there at Vanderbilt, and I'm very thankful for them because they taught us a lot of the things that are vital to my training. But the good part of it, too, is we had outside orthodontists, much like myself at this point, that would come into school and teach us also. Which was nice because you had, quote, the real-world orthodontist coming in and teaching you some day-to-day things that really helped us going into practice. Mm-hmm. But I had one, Dr. David Sane, who actually had a van at the time that he was using to pick up kids. And to my knowledge, he was the originator doing that. And at the time, I thought that this guy was crazy, that how in the world could you go and pick kids up, and the liability and just all the dynamics around that. Mm-hmm. At the time, I didn't really understand. But as I got into life and understood and had kids and understand the craziness and the busyness of life, I quickly realized that what an asset that is to our patients. Mm-hmm. And the service side of it is tremendous. And at this point, I just couldn't imagine practicing without our taxi service, because it's a lot of fun. It's a great service in the fact that so many parents are working these days, and it's just nice to be able to know that we'll come pick your child up. We're very careful about who we select to drive those taxis.
Oh, I'm sure you are. Yeah.
We pick great moms that are great with these kids, and of course we do background checks, and so now it's just a part of our culture, and the kids love it, and it's just a great service for our parents.
Well, I guess part of our community, we're thankful for that professor you had back at Vanderbilt.
Absolutely.
And I'm just thankful that, growing up in the 60s and 70s and someone who had braces, we never had orthodontists here. And every month, Daddy would have to take me to Macon because that was just the way you had to go to a big town to see an orthodontist. But tell us a little bit about your family.
Have three boys. We have a 21-year-old, and I have one 21-year-old at Georgia Southern. He's pre-dental, hoping to go to dental school. Wow. My 19-year-old is along in some of the same lines you are. He's working for Ultimate Outdoors down in Valdosta doing hunting shows. So he's being trained and he actually has produced some hunting shows, and he's doing that and loves it. Yeah, he's loving life. He's enjoying that. And then he's 19, and then we have a start-over surprise at home who is 7 years old. All boys. So, I always wanted that little girl, but I the good Lord knows who needs what.
That's
so,
right.
But I do get to live it every day in my practice, and watching these kids grow up, and you get attached to them. And I have lots of young ladies that I've had the pleasure of treating and taking care of, and I feel like they're my family. Mm-hmm. So, I've just been blessed in a lot of areas, and just thankful to do what I do. Of course, I have a lovely wife at home who's the backbone of everything I do, and
Amen. Very
thankful for her. So, have a great family, great parents. I grew up with mom and dad were just amazing, and just been very blessed to have great family and throughout my life. So.
Yeah, and I know you're very involved, always have been in your community and your church, and I know your faith's very important. Why is that?
Fortunately, I was around some people who influenced me. Really, not so much early on. I grew up in church, off and on, but I was around some really good Christians in my later teens, and when I was in college, and particularly a colleague of mine that I watched day to day, and I just watched the peace that he moved through life with. Mm-hmm. And I wanted some of it. And he was just a great witness to me, and I actually got saved before I started dental school. And it was through that influence. You often wonder who's watching, mm-hmm. And watching you day to day and just seeing how you go through life. And I'm far from perfect, but, it's just he was a great example to me. And, he basically was a big part of me being led to the Lord. So very thankful for those relationships and being able to watch somebody walk the walk,
Yeah, nothing like those seeds being planted throughout our lives. And at the time, a lot of times we don't know, but God's taking care and making sure those seeds grow. And just like you're talking about in your life there.
Absolutely.
I love that. And you mentioned your son in pre-dental, I think. Well, what made you get into orthodontic? Did you have somebody?
It's kind of interesting. I always wanted to do something in the medical field, and I never really was quite comfortable with the hospital sick thing, And my dad had become friends with a dentist, and I'm still trying to figure this out about parenting, but my dad was one of those guys that could just speak it, and I would kind of just do it. And I have two older brothers; they would just kind of do it too. And he walked in one day and he said, "Hey, you should be a dentist, because they pretty much they're at home on the weekends. They don't have a lot of call. They have sun. They get to spend time with their family, And I think it's a good way to make a living." And he sort of mentioned that to me. I looked up at him and said, "Yes, sir."
Okay, good.
And, started down the path and just never looked up. Fortunately, right before dental school, I went in an orthodontic office and absolutely loved what I witnessed. And I was like, wow, this looks like a lot of fun. And got into school and was fortunate to do well and was able to apply and get into an orthodontic residency. And it's been great ever since. I absolutely love what I do. It's awesome.
Well, I've been in your waiting room 2 or 3, maybe 4 times, and of course, I love to pass the time of day with people. I don't care where it is.
Yeah.
And talking to people in your waiting room seems like they're happy people, happy patients is what
Sure.
I'm trying to get to. But what is an office visit like to not only children? You have adults
Sure.
coming in out there, but what's
Absolutely.
an office visit like here?
Look, it's it's so much not about me and Dr. Goggans so much. It's really about our team and who we are. And the culture that we want to create when the patients come in our door. So, I tell new patients all the time that I'm just a piece of the pie, and it's really this group of absolutely wonderful employees that we have here that buy into. I tell them all the time that we're going to love on people first, and we're going to straighten their teeth secondarily, so that and we're going to be great at both of them, but we're going to put the love piece first, and if we'll do that first, it'll all work out. So, I really want that when people come in and go through treatment with us. I just want them to, obviously, we want to be able to provide the best treatment that we can. My goal is for them to be able to go anywhere else in the world and get as good orthodontic treatment as they can right here in Dublin, Georgia. But the other piece of that is I want them to feel better after they leave about their experience. It's just an opportunity to share time with people, and I would hope that when they're through with orthodontic treatment, of course, we're going to come in and we're going to work on those wires and we're going to change some things. But at the end of that visit, I hope through their experience here, they leave here feeling a little better.
Okay, 2-part question. What about consultations? Do you do consultations? And part B of that question is, do I have to be referred by a dentist, or can I just call up today and say, hey, I really don't know what direction to go with my child. Will you talk to me?
Sure. It works both ways. We certainly do have a lot of referrals from our general dentist, and we work closely with them, and we're very pleased. We've enjoyed becoming partners with a lot of the general practitioners here in town. What we have determined quickly in Dublin is there's a lot of great general practitioners here, and we're enjoying our relationships with them. So certainly at times your dentist, you may go in for a cleaning, your dentist will say, hey, it looks like you need to see an orthodontist, here's the referral, and the patient comes in and we do x-rays, photographs, and take a look, and we'll let you know at that time, what you need as far as your treatment goes. The other side of that is you do not have to have a referral. We have a lot of people who just call us up that are concerned about how their teeth look. So, you certainly can just come in and see us without a referral too. So it works both ways.
And someone watching us right now, like, talking about myself back in the 70s, they say, well, I had braces that like to kill me, all that metal in my mouth.
Yep.
It's changed over the years, hasn't it? Tell me, over the last 20 years or so, how has orthodontics changed?
It's been amazing. It really has. I look back literally from when I started 20 years ago to where, it would take 4 hours to get braces on. Mm-hmm. 4 to 5 hours, and there were rings around the back teeth and what we call bands and the spacers and the separators. And, to this day, we're probably about 25 or 30% adults, but oftentimes an adult may be going through a retreatment. I'll say, what do you remember about orthodontic treatment? They'll say, they're separators, they're spacers, because those things hurt.
Rubber bands.
Rubber bands, yeah. So, these days we don't use the rings. We use little bondable braces everywhere. It's much more hygienic. It's much kinder. The way the braces are designed today, the force levels that we use are way less. Mm-hmm. So there's still some, at times, discomfort, but it's a gigantic difference.
Less, huh?
You know, we've gone from it taking 4 hours to get braces on to where we can have braces on in 30, 45 minutes.
Wow.
It's pretty amazing.
Big difference.
It's a tremendous change in technology, which is a great thing. You know.
And someone, I can tell you love your patients and watching you in the office, so you've got to love that too, to make it easier on
Absolutely.
the patient.
It's without a doubt. It's much more enjoyable all the way around. It's just
what about headgear? Some people have to use like a headgear, some don't. What is that about?
Yeah, you know, I was trained on headgear, learned how to use the headgear, but we really, you know, fortunately there's been some other things developed that we've essentially eliminated the headgear in the day-to-day practice of orthodontics. But essentially what a headgear is for is to help with an overbite. So if you have your front teeth ahead of your bottom teeth, you would put a headgear on the top teeth to try to hold them back and allow your lower jaw to grow forward. Whereas today we've got devices we can put in to bring the lower jaw forward and to keep those kids from having to wear those headgears. So just, again, advances in technology and to really allow us to get some great results.
If you need work on your teeth, do you need to get all this done before they come see you, or do they need to come and have a consultation and you kind of guide them through those stages, or how do you do that?
That's correct. You know, obviously a patient can call and come in to see us, and then if we determine that they need some dental work, we'll send them back out to their general dentist and have that done. But it is imperative that your mouth be healthy before you undergo orthodontic treatment. So, you know, it's important that cleaning be done, and certainly don't want any active decay in the mouth, because as we put braces on, we don't want to cover anything up that could just get worse. So, you know, we certainly like to be partnered with our general practitioners through this process so that the overall health of the mouth is excellent, and you know, we're able to get a great result. And
you've got to, and I was born and raised here, but you've got to love this area because we have some great dentists here.
Absolutely.
So that's got to help you.
It's been amazing. I'm telling you, we started here in October, and you know, Dr. Myers, we took over this practice from Dr. Myers, who's just a joy.
Absolutely.
Great man. I enjoyed, and I just was thrilled to have the opportunity to experience some time with him. And you know, but coming into the community here, number one, we've had a blast, and we were thrilled to be here. And the dentists that we've worked with have been amazing. So look, we're just excited. We're thrilled to be here, and we're looking forward to becoming part of this community and hopefully providing treatment to folks and just really trying to make a difference.
Can crooked teeth correct themselves?
Unfortunately, as we age, the dental arches decrease in width. Mm-hmm. So if anything, you tend to see teeth get more crowded. I remember my first week of school, we took a lot of growth courses, and I remember sitting in the course, and my professor stood up. I went to Vanderbilt, and you know, he stood up and he said, by the age of 6, the width of your dental arch is established. Now, that just doesn't make any sense. When I watch a 6-year-old walk in and he grows from, 4 foot to 6'5", I'm like, wait a minute, I don't think this guy knows what he's talking about. But it is true, the actual width of your dental arches are established at a very young age. And even though your body continues to grow and you're still growing in the head area, the arches don't. So pretty much as you get older, the condition gets worse. So.
Is there anything that these just been some of my questions? We talked off camera. I interview a lot of doctors, and I come up with my own questions. But is there something I hadn't touched on that's really important to you and Fender-Goggans?
You know, I think, for us, we love what we do. I think what we offer to the community is we have just an amazing team of highly trained ladies that work in here with us day in and day out, and our goal is just to come in here and be a part of this community. We're thrilled to be here, and we just want to come in and it's pretty amazing at what I get to get up and do every day. I mean, to be able to take a young person who doesn't want to smile and watch that process of them, in adults also, but watch that process of being able to change their demeanor and their smile and their whole the whole face. It's amazing at what all changes when you're able to put braces on or Invisalign and make those changes. Just to be part of that process is just absolutely amazing, and it's just fun to get up and go to work every day. And again, we're thrilled to be here, and I appreciate you coming by and giving us the opportunity to visit and be a part of this. So,
well, I enjoyed talking to Dr. Goggans, and I don't know if he told you this past week, but when I mentioned you, he could not recall your name, and we did not edit that part out of the show on purpose.
Oh, that's great.
It was really funny, as good as y'all know each other and love each other.
Absolutely.
But you know, just you deal with so many people every day. Sometimes you can't grab that certain name. We're not getting any younger. So.
Hey, he and I are interchangeable. Patients look at me and say, "Dr. Goggans." I don't even. You know, I'm like, that's good. We've been working together for so long now, and he's been an amazing mentor, partner to me. Greg's got about 10 years of experience on me. I've been doing it for 20. He's been doing it for 30. You know, and it's just great. It's been a blessing to have such a high quality guy to treat patients with and interact with on a day-to-day basis.
He is a great guy, and you got him back because you just said he's older than you are. So it all. See, he got the last interview,
right.
But Dr. Dana Fender here at Fender-Goggans. We're right here on Hillcrest Parkway. You've heard just our short conversation here. The number's on the bottom of the screen. If you would like to just come in and talk to one of the doctors and have a consultation, they'd be glad to help. Like I said, the number's right there on the screen. Just pick up the phone and call them. Fender-Goggans right here on Hillcrest Parkway in Dublin.
There's a story behind every smile. Fender-Goggans Orthodontics, where smiles happen and lives change. Text braces to 313131 or call us at 888-FENDER-4.